Iron deficiency is something I see missed all the time. Sometimes because nobody checks iron in the first place, and sometimes they check ferritin, your stored iron, and the bottom of the lab range can be 10 or 15. So your ferritin comes back at 18. Not flagged, everything looks normal. Wonderful, except you feel like you got hit by a small bus. You're exhausted, your brain has left the building, you get dizzy when you stand up, your workouts are terrible, and your hair seems to be making its own plans to move out. But your hemoglobin is normal, so you're fine, right? Not necessarily. Hemoglobin can be a late sign of iron deficiency. You can deplete your iron stores long before you actually become anemic. There can also be subtle clues in your regular blood count before your hemoglobin ever drops. In my practice, I generally want to see the ferritin above 60. And depending on the patient and the clinical situation, I may be looking closer to 100 rather than simply celebrating because the lab didn't put an L next to it. I've actually had patients come into my office with a full iron panel they paid cash for themselves because they couldn't get a provider to do it. I admire the commitment, but you shouldn't have to become your own part-time medical detective. Be persistent. Ask your provider, I want a full iron panel and ferritin checked, because not flagged doesn't automatically mean everything's okay, and it definitely doesn't explain why you feel terrible. Your lab should just get a green check mark. Somebody needs to actually interpret them.